The eye may be the smallest organ in the body, but when damage is done to the eye, it is evidence of damage elsewhere in the body. The Ministry of Health and the Environment hosted a two-person team from the London School of Hygiene and Tropical Medicine, who are managers of the Queen Elizabeth Trust Diabetic Retinopathy Program that is headed in Dominica by ophthalmologist consultant Dr. Hazel Shillingford-Ricketts. Dr. Shillingford-Ricketts explained that time is of the essence for diabetics to have their eyes checked, and she needed to find a way to have them seen quicker than the 1 year it took to get an appointment through the records department. And with the help of organizations such as PAHO and nurse Nanda Matthew, she was able to make that change.
The month we designated it to be a diabetic retinopathy clinic, so that when she took the photos, she looked at the screen and she would detect whether they had the disease, and she would then refer them directly to the diabetic retinopathy eye clinic. And so patients no longer had to go for the records department to get their appointment. And I would see the patient, and if the examination revealed that they had vision threatening diabetic retinopathy, they would be scheduled for laser. And this laser is available at the hospital, and it is available free of charge for patients seen at the diabetic retinopathy clinic, because laser is still the gold standard treatment for diabetic retinopathy. So our diabetics do not need to travel overseas to get their laser treatment. However, they need to be seen before the lasers can be scheduled.
And celebrating the 60th anniversary of the Queen's reign, she used some of the monetary gifts received to fund the screening program for diabetic retinopathy.
This is where Dominica came in very handy, because of our experience in the program. We played a very important role in developing the proposal by the Caribbean Council for the Blind, which is based in Antigua, so that they could submit this proposal to the Queen Elizabeth Diamond Jubilee Trust. And based on that submission, they were successful in getting over £1 million to fund diabetic retinopathy screening and treatment program in 3 countries: Jamaica, St. Lucia, and Belize. And in Dominica, because we had a program already, we got funding to expand our program. So
Dr. Corva Baskaran of International Center for Eye Health, London School of Hygiene and Tropical Medicine, explained that the purpose of the visit was to observe and assess Dominica's program.
So the assessment is very positive. There's a lot has been done even before the involvement of this specific program. The eye care team here spearheaded a national program for diabetic retinopathy screening and treatment, and in the last 2 years the Ministry of Health has supported the program in training the personnel that's required to identify all the diabetics that will need an eye check in order to prevent avoidable.
And according to Baskaran, the program is working well.
Most positive development has been that it's very comprehensive. It covers the whole country. It has a very broad coverage. There are good professionals trained in screening. The equipment was put in place through the trust funding, and health promotion activities started to be developed in phase 1 as well. Looking forward to phase 2, we will work on strengthening that training through adding an international certification training to the screener graders that are already working in the program. There's also need for more equipment, particularly the mobile equipment cameras, which have allowed the program to cover the whole country. And there will be big input on health promotion activities to increase the number of diabetics that are aware of this screening program.
Okay, in terms of funding.
And Dr. Shillingford-Ricketts informed that screenings are done Monday through Thursday at the eye clinic at the Princess Margaret Hospital, but mobile screenings are also available in the outer districts. She lamented, though, that many do not take advantage of the opportunity to get screened.
Our patients have not been really keeping their appointments. Yes, the compliance has been poor, and so we want to urge the patients that diabetes is the leading cause of new blindness in our working population. That is our 25 to 50 age group. That is our age group that should be working and looking after their family and developing the country. And this diabetes is what is causing this age group, blindness in this age group. And we know if we detect it early and it is treated, that we can prevent blindness. There are some persons that have come in too late, and even if we try, it still does not succeed in restoring their vision. And hence the lesson we learn: we do not have to wait when you cannot see to see. The eye is a window to the soul. Well, the eye is a window to your health. When we look in the eye and we see that your eye is already affected by the diabetes, it tells us that your heart is affected, your kidney is affected, the circulation to your feet is affected.
And prevention of blindness from diabetes is most effective before vision problems begin, she emphasized. Shillingford-Ricketts stressed that it remains important to educate the public about diabetes and the effect on the eyes, and called on the nurses and doctors in the various districts to be vigilant and proactive in educating themselves and their patients.